it's Dr. Joyelle, and welcome to the Women's Health Pro Show, where we empower and educate women to own their health. We also talk about real issues that don't get enough attention. The vagina is the most ignored organ, and we need to have more conversations about it, especially around vaginal dryness, because 20 to 50% of women are suffering with vaginal symptoms, especially during menopause. And we need to have this conversation. So I'm welcoming back my friend, the expert, Dr. Suleika Michel. Welcome to the show.
Good to be back. Good to be back. This is going to be an awesome discussion.
Yes, I'm so excited. So let's just jump into it. Vaginal dryness. What are some causes in regards to vaginal dryness itself? Let's talk some causes about vaginal dryness before even menopause. So what other things can cause vaginal dryness?
So before menopause, so we know that usually in the 20s and 30s, when we see patients who are having vaginal dryness, a lot of times it's hormonally related. And sometimes, honestly, it can be because of the contraception that they're taking. It can also be because of any other medications that they're taking. And if it has to be directly associated with intercourse, then foreplay and some other components of intimacy can also contribute to vaginal dryness. So I'd say probably in about the ages in 20s and 30s, that's usually our most common culprit as patients start becoming in their 40s and 50s, that perimenopausal and menopausal transition can definitely throw the vagina out of whack. And but we have some help for all those issues.
Right. So let's go right into perimenopause and menopause and those changes that happens after 40. So when women are coming in, they are having pain. The stories that we hear, it feels like sandpaper is rubbing together when I'm having sex. Mm-hmm. I'm feeling so irritated and itchy, like I can't even work throughout the day because I'm feeling so irritated. So what is happening in regards to our estrogen levels in the vagina that's causing this dryness?
So estrogen is really key to long-term vaginal health. And the concern is that, or the issue is that we stop producing estrogen when we become menopausal, essentially. So we need to find other ways to keep that lining moisturized, and not just moisturized on the surface, but actually underneath the surface, because that's what provides the elasticity for intercourse and to actually use the vagina. So with decreased estrogen, there are a few different options. We can do non-hormonal options or hormonal options. And usually I just start them off with over-the-counter lubricants, water-based lubricants. You don't want to put oil-based lubricants in the vagina. Oil actually attracts bacteria. So we want to use a water-based lubricant. And there are a number of items that can be found over the counter. There are other companies that sell wonderful water-based lubricants, but that's usually the first go-to for a particular type of non-prescribed medication.
Great points. And let's also put out there, please do not use Vaseline or baby oil.
Exactly. No oil. No oil.
Especially condoms, because they don't mix well together, right?
Right. You definitely don't want to use any oil-based lubricants with condoms because it can break down the latex.
Right.
So it decreases the efficacy of the condom. So you always want to use a water-based lubricant, particularly if you're using condoms.
Right. So in regards to lubricants, so there's lubricants and moisturizers. So lubricants we typically use when you're actually having sex, and moisturizers are those things that you can actually use on a, either a daily basis or every couple of days basis to kind of help moisturize the vaginal walls. So what are some of the things you have recommended for women to moisturize the vagina?
So we actually have a really, really commonly used medication that has come out within the past couple of years that uses hyaluronic acid to help with moisturizing. And patients get a really, really good effect from that. And we tend to offer that to patients that really want to avoid hormones altogether, or really have to avoid hormones altogether. Not everyone is able to use hormones. For our patients who have had histories of breast cancers, of uterine cancers, or have a family history of clotting disorders, or some other type of health is concern that requires them to avoid hormones, there are other options that are non-hormonal to give them some relief.
Right. And just regards to that option is a suppository for everyone to know that you actually would place it in the vagina every couple days just to kind of, again, help moisturize it. And you can also use lubrications in between when you do have sex. So it's not like you have to just use that. You can use that in addition to lubrications when you do are engaging in sexual intercourse. So moving on to hormonal treatment in regards to vaginal dryness, specifically estrogen, because that's what you mentioned before. That is what is decreasing as we're getting older. The lack of estrogen affects the vaginal environment. So there's different preparations of vaginal estrogen that we offer to patients. One is vaginal cream. Right. So and a lot of people, they don't like the cream because it's a little messy, which I understand. So what are some other preparations that women can use to help add that estrogen?
So, well, to backtrack, we're huge advocates of vaginal applied estrogen, as opposed to taking estrogen or hormonal replacement by mouth to address a vaginal concern. We really feel like the least amount of estrogen we can get through the entire body is safest for our patients. So for the vaginal applications for estrogen, it's the creams. It can be a tablet. It can even be a ring. And a ring actually goes in very similar to the birth control NuvaRing that many people may be familiar with. The estrogen ring actually just goes in the vagina and stays in there for 3 months, essentially. And it gets changed every 3 months. So it's really, really easy to use. It can stay in with intercourse. And it provides a low dose, consistent stream of estrogen to promote vaginal health and to really get to address the dryness as well as the elasticity. So essentially, it's usually the creams, the tablets, and the rings that we tend to use. And a lot of times, it really depends on where the discomfort primarily is. So for patients who are primarily concerned about vaginal dryness, the actual vagina itself, we tend to want to get something in there, and those options work well. For people who are having difficulty with dryness on entry, we tend to try to get some type of medication that we can place on the outside to help with entry, and that usually tends to be a cream.
Great points. And to piggyback off of that, with vaginal dryness, there's also women who can have urinary symptoms, especially irritation around the urethra, things like that. And when they use a cream, we often recommend using a little bit of cream just around the urethra to kind of help with those urinary symptoms too.
Exactly. And then for those who either don't want to use hormones or can't use hormones, or they've used it and haven't been completely successful or don't want to continue to use them long term, there's also laser vaginal rejuvenation that we actually offer in our office, and found patients have really, really good success with that.
Right. Laser therapy in regards to essentially rejuvenating and stimulating collagen production in the vaginal walls. That's how it essentially works, where it actually breaks down initially the cells up under the vagina. The collagen builds back up, and it becomes more vascularized and more elastic. So it really works well for women who, like you said, who either cannot use estrogen, or they have used estrogen or other preparations and it hasn't worked. They have laser therapy as an option. Is there anything else that you can think of in regards to what other options women may have to help with vaginal dryness? In addition to that, is there something else that you can think of that would be helpful?
I think when I have this discussion with my patients, what I also try to address are relationship concerns, because sometimes there may be something else going on in the relationship, or else just for the female, we're multitasking all the time. So if the mind isn't engaged in the intimacy process, and they're thinking about their dishes in the sink and the baby's about to get up and so forth, and may not be able to get quite in the mood. We talk about trying to time certain situations, and really try to address the relationship itself, so that foreplay can also contribute to to relieving vaginal dryness, particularly during intimacy.
Great points. And the other point is that women need to know is frequency of sex. Like, we have women coming to the office and I haven't had sex in a year. That's a problem. That's a problem. And when you're not frequently having sex, that also contributes to the dryness. So, the phrase, right? If you don't use it,
you'll lose
it, right? So we have to clarify, though. We are talking women who are already in relationships. So what do we say to those women who are not in relationships right now, who are about to go out into the dating scene after being divorced for 1 year, 5 years, and really haven't engaged in sexual intercourse?
So I encourage them to try it first, because I think a lot of women tend to be a little bit afraid, thinking the worst is going to happen, and sometimes it works out fine without any additional help from us. But if they do engage in intercourse and they do experience extreme vaginal dryness or difficulty with entry, that's when we can come in and step in and try to provide a solution for them, so they can have a healthy, fun sex life.
Right. And I also talk about sex toys. Sex toys do come in handy if you do not have a partner. So they can also use sex toys just to kind of, again, try to reintroduce, essentially into sexual intercourse again. And that can kind of, help them to kind of figure out if they are having an issue in regards to dryness, and they can address that before they actually engage with a partner.
Once again, with the water-based lubricant, not the Vaseline.
Right. Exactly. And another point I want to put out is that vaginal dryness is definitely real, and don't ignore it, because with menopause, especially with menopause, hot flash and things like that, those symptoms actually get better as you get further out into menopause. Vaginal dryness gets worse. So it's definitely important to reach out to your GYN or your healthcare provider as soon as possible when you're noticing these symptoms, so you can address it early rather than later. So you'll be able to use her like you should. Well, thank you, Dr. Suleika, for coming onto the show. If someone wanted to reach out to you, ask you some questions, buy your book, where can they find you?
I am Dr. Suleika Michel on all social media. That's DrSuleikaMichel. No extra L, no extra E.
Great. All right. Well, until next time, this is Dr. Joelle, where we have real talk about real women's issues.